Hi, my name is Sidhbh Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery, and I'm based right here in Indianapolis, Indiana. And so today I want to talk about a pretty exciting topic that more and more patients seem to be asking me about, and that is what the story is with a peritoneal vaginoplasty. So I think most of the interest in this came about in late 2017, where there was an article published, a pretty cool article about a transgender woman who, along with her surgeon, Dr. Jess Ting, at Mount Sinai in New York, helped to innovate a technique to use the peritoneum in order to line the new vagina. So the first thing of course, is what is the peritoneum. So just like your skin lines the outside of your body, on the inside of your belly there's a skin or a surface called the peritoneum. So the peritoneum is smooth and shiny, and the idea is to go in via a laparoscopic technique, so using little incisions, and to take out some of this peritoneum and help create the vagina from it. Whenever we are thinking about a designer vagina or the ideal vagina, obviously there's a few things we would love to have. Number one, not to have to dilate. Number two, a vagina that lubricates during sex. And number three, a self-cleaning oven, as it were, tissue that secretes mucus, so it cleans itself. And that, of course, is the hope maybe with this technique. So the interesting thing about using the peritoneum to line a vagina is it's actually not a new technique at all. This technique was first described in Russia, and then in 1969 a guy called Dr. Davidov was probably the first person to describe it. And so there is a fair amount of literature and studies done on this technique in cisgender women who were born without a vagina. So about 1 in 4,000 to 5,000 cisgender women are born without vaginas, and various different techniques have been used to help recreate this vagina. So the peritoneum is a very nice option, because if you think about it, obviously there isn't too much available to line a new vagina in these cisgender women. We don't have that penile skin or the scrotal skin, so being able to avoid scars on the outside of the body from taking skin grafts, this is a very nice option. And there are some good studies. There's a nice Chinese study showing good outcomes at 10 years of follow-up, and then, interestingly, there's also a study from the Indian literature about a phenomenon called metaplasia. So metaplasia is a really cool thing, and let me just explain what that is. So in plastic surgery, we're oftentimes borrowing from one part of the body and putting in tissue in another part of the body that it's not used to. So an example of that would be, oftentimes if we're doing a reconstruction, we're trying to line the inside of the mouth, we may use for example, tissue from the forearm right here. And one of the really cool things you will see at about 6 months after that tissue is put up inside the mouth is that it's very hard to tell that that tissue ever came from the forearm, and it indeed begins to change, or this metaplasia happens because it adjusts to its new environment inside the mouth. And the question is, does this happen with peritoneum? And it looks like it does from that Indian literature that they did biopsies of the peritoneum on cisgender women, and showed that yes, it did resemble at about 9 months, it resembled a vagina. So I have my theories as to whether or not this happens when we invert penile skin or scrotal skin. One of my mentors, Dr. Harold Reed, published a very cool paper on this, and he was able to show that the penile skin does have signs that maybe it's producing this mucosa. But again, unfortunately, like so many other things in gender affirmation surgery, we need to do more studies, and we really just don't know. So when it comes to making a decision about your surgery, there's a couple of things we do know. So first of all, the satisfaction rates from the penile inversion technique long-term tend to be very high. This is an excellent surgery. It's got an excellent track record, and it really is a known entity. We know that it works. The peritoneal technique is a new technique. We can see from the gynecology literature from cisgender women, there's a lot of different ways to do it, and how well they will translate into good options for transgender women, unfortunately, we don't quite know as yet. One group of patients this could be really useful for is patients who were put on blockers early, so didn't develop much tissue down there at all, and really don't have a lot of genital tissue to work with to create a deep vagina. So this could be useful for that group. Dr. Ting and his group in Mount Sinai have not as yet published their outcomes. We see from the rumor mills online that they've done maybe about 30, but again, this is just rumors. I don't know if that's true or not, but we certainly look forward to his group's findings and publications. It's an innovative surgery, but again, penile inversion is certainly tried and tested and is a very acceptable way of doing vaginoplasty.